qualifies for low-income drug rehab in 2025? If you or a loved one are struggling with substance use disorder and facing financial hardship, it can feel overwhelming to find accessible, effective treatment. But in 2025, a range of programs exist specifically to help low-income individuals reclaim their lives through comprehensive drug rehab services tailored to those with limited resources. Eligibility typically hinges on a combination of factors including household income at or below 150% of the federal poverty level, lack of adequate health insurance coverage, residency within states or counties that allocate funding for subsidized treatment, and, in many cases, demonstrated need through documentation such as tax returns or proof of enrollment in public assistance programs like Medicaid or Supplemental Security Income, SSI. Beyond income thresholds, some programs prioritize individuals who have co-occurring mental health disorders, are pregnant or parenting, have a history of homelessness, or have been involved with the criminal justice system, recognizing that these populations often face multiple barriers to recovery. Many low-cost or sliding-scale rehab centers also consider the severity of addiction, offering tiered levels of care, from outpatient counseling and group therapy to residential treatment and medically supervised detox, based on clinical assessment rather than the ability to pay. In addition, community health clinics, nonprofit organizations, and faith-based initiatives collaborate with state and federal agencies to extend funding through block grants and partnerships, ensuring that even those without Medicaid can access inpatient facilities or intensive outpatient programming. Some rehabs further reduce barriers by waiving co-pays, providing transportation assistance, and offering childcare services so that parents can attend sessions uninterrupted. Qualifications often include commitment to a treatment plan, willingness to participate in aftercare programs, and engagement with case managers who help navigate the application process, secure housing or vocational training, and connect with support networks. Veterans, Native American populations, LGBTQ+ individuals, and adolescents may also find special programs designed to meet their unique cultural or developmental needs, with eligibility defined by tribal enrollment, military service history, or proof of age and identity. Even if your insurance doesn't cover addiction treatment, nonprofit rehab centers frequently collaborate with pharmaceutical assistance programs to provide medication-assisted treatment, such as buprenorphine or naltrexone, at little or no cost, ensuring that medication access does not become a hindrance to recovery. For many, the first step is to complete a confidential assessment through a designated helpline or an online screening tool, which quickly determines qualification based on income, insurance status, and clinical needs, then refers applicants to the nearest qualified facility offering sliding scale fees or fully funded slots. In 2025, telehealth options have expanded dramatically, enabling rural or remote patients to participate in virtual group therapy, one-on-one counseling, and medication management without the burden of travel, with eligibility for these services based on the same low-income criteria to ensure equitable access. With legislative advances allocating more resources to community-based mental health and addiction services, the range of qualifying individuals now extends to cover those re-entering society after incarceration, people living with HIV, AIDS, and survivors of domestic violence, underscoring a holistic approach to recovery that addresses social determinants of health. Wherever you are on your path, whether just recognizing a problem or seeking to prevent relapse after detox, you can find a program willing to work with you financially and clinically, provided you meet the guidelines for low-income status, residency, and commitment to treatment. Don't let financial constraints stand in the way of a healthier future. Resources are available, staff are ready to help, and scholarships or grant-funded spots are waiting for you in every state. Visit website grantsbuddy.com for more information.